So I think most people joined. Thank you all for joining us again. And I think we will get started now. And I'll hand over to Tilman for introduction. Over to you, Tilman.
A warm welcome to our virtual fireside chat. My name is Tilman Rüppel. I work at MedMissio and I am a board member of Action Against AIDS Germany. And I am delighted that you are here today for our second fireside chat of the year and you are interested in this very important topic about gender under pressure and the impacts of anti-gender movements and toxic gender stereotypes on HIV programs worldwide, as we would like to use our fireside chat format to create a space for constructive discussion instead of polarized debate. Before we dive straight into the topic, however, a brief organizational note. Today's discussion will be recorded and published afterwards. Additionally, this fireside chat will be held in English and no translation is provided. I would also ask that you keep your cameras and microphones turned off to ensure that the event runs smoothly. Furthermore, at the end of the event, we will take a group photo in the form of a screenshot. But before we begin the discussion and introduce our distinguished guests of today, I would like to say a few words about the background and purpose of this conversation. Since, from the perspective of an NGO working in the field of HIV, we are witnessing a growing global backlash against gender equality, sexual and reproductive health and rights, as well as the rights of LGBTIQ+ communities. This backlash is no longer abstract or purely ideological. It is increasingly shaping policies, funding environments, and the operational space of HIV and health programs worldwide. Gender norms are not peripheral issues, they are structural determinants of health. They strictly influence vulnerability to HIV, access to services, and health outcomes. When gender equality and rights-based approaches are undermined, HIV responses lose one of their most critical analytical and operational foundations. Because, according to current UNAIDS data, these structural inequalities remain stark. Globally, around 4,000 young girls and women become infected with HIV every week due to gender inequality and limited control over their sexual reproductive health. Trans people, particularly trans women, face approximately 20 times higher HIV risk compared to the general population, largely due to stigma, violence, and restricted access to health services. And similarly, men who have sex with men face a 25 to 30 times higher risk of HIV infection, driven primarily by social discrimination and barriers to prevention and care. At the same time, we are seeing increasing political and ideological pressure on global health financing and evidence-based policymaking. One of the most prominent examples is the so-called global Gag Rule, officially known as the Mexico City policy. Since its introduction in 1984, it has been repeatedly rescinded and reinstated along US partisan lines, creating long-term instability in global health programming. Over the past 4 decades, it has been in effect for approximately 23 years. But beyond its original intent to exclude abortion service from family planning programs, the policy has historically had broader implications for health systems and partnerships. In its most recent and expanded form, introduced by the current US administration, it has gone significantly further by including restrictions related to so-called discriminatory equity ideology and gender ideology. It also extends its reach to a wide range of foreign assistance recipients, including national and international NGOs, multilateral organizations, and foreign governments, with an estimated financial scope of up to $40 billion. In parallel, the global HIV response is increasingly affected by a broader anti-gender discourse, including the resurgence of rigid and traditional notions of gender roles and harmful stereotypes of masculinity and femininity. These developments undermine evidence-based programming and weaken interventions targeting populations most affected by HIV, including women, girls, and LGBTIQ+ communities. Taken together, these dynamics risk weakening global HIV efforts by reducing the space for integrated HIV and SRHR programming, undermining civil society and community-led organizations, and limiting the use of evidence-based approaches in global health policy. For organizations working in HIV, these developments raise serious operational and ethical concerns. First, we observe risk of confusion, over-implementation, and a chilling effect, where organizations may limit activities beyond what is strictly required due to fear of non-compliance. Second, we see the potential loss of civil society coordination and partnerships as organizations disengage or are excluded from collaborative networks. And third, there's a significant increase in administrative burden diverging already limited and decreasing resources away from service delivery and community engagement. Against this background, the goal of this discussion, Gender Under Pressure, is to address the impacts of the anti-gender backlash and ideologically driven health financing and global HIV work, and to identify strategies to strengthen evidence-based and human rights-centered approaches. In an increasingly polarized global environment, safeguarding the effectiveness, inclusivity, and scientific integrity of HIV responses is not only a policy challenge, but a public health imperative. But now, and without further ado, I want to give the word to my dear colleagues and moderators of today's discussion, Sasha Gurinova and Peter Wiesner.
Thank you for this introduction, Tilman, and hello, everyone. I'm very happy to moderate today's discussion. My name is Sasha Gurinova, and I work for Deutsche AIDS-Hilfe in Berlin, Germany. And today is actually my 43rd birthday, and I woke up this morning and realized that I have spent half of my life working on HIV, harm reduction, inclusion, and gender equality questions. So it feels especially meaningful to be moderating this conversation today, as we are not only exchanging information, but also understanding realities behind the data. And also how gender identity shapes power, opportunities, and access to healthcare. We have great panelists today: Kate Nyambura from Athena Network, Amanita Calderon-Cifuentes from the GU, and Gracia Violeta-Ross from World Council of Churches. They will have a possibility to introduce themselves and their work a bit later today. And it's always a pleasure for me to moderate together with Peter Wiesner. Over to you, Peter.
Yes, my name is Peter Wiesner. I work for Action Against AIDS Germany. It's a pleasure to work with you. Happy birthday from my side. Absolutely fantastic being with you here together. I don't have birthday today, you have, but when you talked about that you spent half of your life within the HIV field, I think I can say the same for me. I'm doing HIV work as an activist, as a person with different roles since 35 years now. So I'm very happy that we have this very timely discussion. Just a brief note on how it's structured. So we have two parts. The first part, the first round of the discussion will be based on what we observe. So what is the impact of the laws and the changes that we see? What experience do we have at country level? And this information will come from our three speakers. And then the second round will focus on what are the solutions? What can we do? What are the strategies that we have to develop in order to overcome this crisis? So with these words, back to you, Sasha, and again, happy birthday.
Thank you, Peter. Kate, hello. I don't remember when I met you for the first time, but I remember that I was really, really empowered by you and your work and the energy behind your work and what you're doing. Before we start the discussion, can you briefly talk about the network you're working for, the work you're doing, and what role plays your organization plays in global HIV response? And as a second part of the question, could you please tell us what concrete impact of the growing anti-gender backlash are you currently seeing in your work and projects, especially for women, girls, and other affected communities? And why does gender matter so much in the context of HIV responses? And you have 6 minutes. Please, Kate.
That's a loaded question and the time is brief, but I will attempt to respond to all your questions, Sasha. Nice to meet everybody and good morning. My name is Kate Nyambura. I am from Kenya and I am based in Nairobi. I work with the Athena Network as the Director of Programs. The Athena Network is a global network of individuals and individuals who are researchers working in the global health space and also organizations working within the HIV response and the feminist space. So we bring in together very intersectional outlooks in terms of lived realities of women and girls in terms of influencing and shaping a gender transformative global HIV response, looking at advocacy, capacity strengthening, and also cross-movement exchanges. We also primarily have programs in 10 African countries in Central, Western, Southern, and Eastern Africa. And we mostly primarily engage adolescent girls, young women, and young feminist movements. So that's who we are. I am really summarizing it, but I will attempt to proceed to the next question about the impacts that we're seeing. For the past 3 years, Athena Network has been intentionally analyzing and mapping and also connecting the dots with other organizations as to the impacts of anti-rights, anti-gender movement. And that's because the impacts are no longer abstract, as we have heard from the opening statement, but really there is chilling effect in terms of what we are seeing practically in work, especially across the continent, which I will speak about as I understand best. We all witnessed the USAID funding cuts last year, and that just meant a lot of fragility in the health systems in terms of disrupting personalized and custom HIV prevention, treatment, and care and support for already vulnerable groups, including adolescent girls, young women. We know that adolescent sexuality and its sexuality is criminalized in many African countries. I think the other bit that we have seen in terms of those kinds of impacts is what we call premature mainstreaming. For folks who are already criminalized in their context, it's difficult for them to access public health services in public health facilities. And so when the policy is for them to access services in facilities where they're already criminalized, it means that you risk exposing them to arrest, exposing them to stigma and discrimination, and just retrenching and regressing back in terms of decades of the progress we have made in the response. The other bit that we are seeing concretely, last week, I think 2 weeks ago, Ghana passed the anti-homosexuality bill, similar to Uganda. And we do have many of those drafts of those bills in many African contexts, including my own country, Kenya. It's just that a lot of activists at the front line are holding the line by advocacy and continued advocacy. But it's just a matter of time before we see a replica of these bills in many more African countries. So we are facing a context of further criminalization, more emboldened retrogressive views on sexuality and sexual reproductive health and rights generally, whether it's in terms of criminalizing access to services explicitly or just undermining guidelines that already exist. For example, in a couple of countries, both Kenya and Uganda, for a long time, ministries of health withdrew guidelines on abortion, on unsafe abortions. What maternal mortality coordination guidelines have been withdrawn in those countries. I don't think these are, most of us who work on sexual reproductive health and rights understand this to be what they are. They are coordinated attacks initially to see how far anti-rights groups can go in terms of advancing regressive values. The other bit is while there is criminalization on one side, there is also a very intentional effort to continue expanding the framework in terms of conservative laws. For example, you have the African Charter on Family Values that's being discussed as a continental framework. It's a very conservative draft bill that's just, highlights things. Of course, it's couched within the language of sovereignty and weaponizing the language of African sovereignty. But the voices that are driving this and the drafts that have been produced are not in consultation with African civil society, or they're not being led by African figures. For example, last year we had a conference on African values, family values, and there was a poster. 99% of the speakers, actually all the speakers, were people from either Europe or the US. Right? And that's not the African values that I want to listen to personally as an African woman and African feminist. So we have seen different versions of this, and I think sovereignty is really at the heart of this. The other very important impact is overregulation of civil society. especially progressive civil society. In Uganda, for example, just before the elections, a lot of the human rights organizations were deregistered or put on a watch list. And this means that there's more surveillance, there's more scrutiny, or there's more rigorous exposure, whether through the tax revenues or through the NGO board. The other bit is that recently now in Uganda, again, a couple of months ago or 2 months ago, there's this new there's a Sovereignty Act that limits the kind of funding flows and designates civil society as foreign agents. So the funding cap that can go through without declaration is $100,000, which is like 85,000 euros. That already makes it difficult to operate for NGOs who are operating in a very difficult context. So these are some of the points that I'm making across. We have seen this expand from Anglophone Africa to Francophone Africa. I can share the report that we are publishing as Athena that extends in terms of specific country context, but generally we see a very grim context that's driven by very conservative values. I think that it's one of the new waves of, importation of problematic values, because this wave is not coming from the continent or driven from the continent. Finally, I'll just talk about why gender matters, is because HIV continues to be a very feminized epidemic. Economic inequality, which drives HIV risk, continues to affect mostly women and girls, including adolescent girls and young women. And finally, gender-based violence, which has a cause and effect relationship with HIV risk, continues to be an issue. And in many countries, we also see cases of gender-based violence rise, including femicide, amongst others. I hope I stayed within my time and I can see people going off the mute. So I'll give it back to you, Sasha. Thank you.
Thank you so much, Kate. Thank you for being on time, but also highlighting such an important questions and issues. Those who are not familiar with Athena Network, please visit their website, read, and support. That's a great network. And Kate, thank you again for highlighting how fragile a health system is and bringing concrete examples, and also talking about access to health is a human right, but on the other side, on the opposite, that people need to tick some boxes in order to get this access. Thank you again. Over to you, Peter.
Yeah. Thank you, Kate, from me as well. Very interesting African charter of family values. What are these family values all about? Amanita, we know us from the UNAIDS PCP meetings. I'm very happy that you are with us, and I'm sure you're going to explain to us what the organization you work for, Trans Europe and Central Asia, is all about, what work you are doing, and what the impact of the challenges that we see at the moment you see at country level in your programs, in your work and in your regions. And as well, the question to you, why is gender that so much important in the context of this discussion, and in particular to the HIV, to the global HIV response? Amanita, we have as well 6 minutes. Over to you, and thanks for being with us.
Thank you so much, Peter. Can you hear me well? Just a thumbs up. Yes, perfect. Thank you so much. Sasha, happy birthday, first and foremost. And to everyone, it's really nice to see you all in here. My name is Amanita Calderon Cifuentes. I am a trans woman from Colombia, currently living here in Berlin, and I serve as the HIV Research and Advocacy Officer for Trans Europe and Central Asia, just as I serve as the NGO Delegate for Europe at the Program Coordinating Board of the UNAIDS program. So quickly, Trans Europe and Central Asia, it's a trans-led organization, umbrella organization that represents more than 250 organizations and over 200 activists across 54 countries in Europe and Central Asia. We work to advance the rights and the health and the well-being of trans people through research, through advocacy, through community development and capacity building. And within the HIV response, we support trans communities by generating empirical data and evidence that then we, through community-led and participatory research, then we transform into legal and policy recommendations that we provide to different regional or global institutions, among them UNAIDS, the WHO, the ECDC, the European Union, so on and so forth. Now, regarding your second question, Peter, when people hear the expression anti-gender backlash, I feel like they often imagine this disagreement about language or ideology, but like for us, for transgender people, this is a debate that it's more about whether we can access healthcare or whether our identities can be recognized by the law, or whether we can safely use public spaces or find employment or build a family. And quite often, to be honest with you, also whether we can survive. Across Europe and Central Asia, the region where my organization works for, we're seeing governments introducing laws and policies that define sex strictly as binary, and this is one of the most difficult gender norms for us to process. Some of the consequences of these measures include increasing restrictions on legal gender recognition and limitations on gender affirming healthcare, and the growing portrayal of the trans communities and trans people as threats for families, for children, and for society itself. And we see these developments happening in countries such as Hungary, Slovakia, Georgia, Kyrgyzstan, Italy, and even the United Kingdom, and many, many, many others. I invite you all to check the Trans Rights Index and Map, which CGU just launched, precisely mapping the maps of trans people throughout the region of Europe and Central Asia. But we also see civil society organizations losing political support and funding opportunities and becoming targets of public campaigns that are designed to undermine our credibility and to undermine our image. So let me give you an example. Trans people across Europe, across all of Europe, are becoming way less visible in national health strategies, for example. The same goes for education systems. And the thing is that when communities become invisible in policy discussions, they often become invisible in budgets and service and data collection. And as a researcher, one of the most worrying and concerning trends that I see is this growing reluctance of governments to collect data on trans populations. If you stop counting people, you stop seeing them. And if you stop seeing them, it becomes so much easier to justify not serving them. So we just made a publication in collaboration with the ECDC and the WHO and the Center for Excellence for Health, Immunity, and Infections Chips, precisely about this topic. I also invite you to take a look at it. And in our work across the region, we also see like this really, really strong impact at individual levels. Trans people at this moment are reporting through, for example, the anti-trans violence project of TGU. They report increasing levels of harassment, social exclusion, fear, and many are becoming way less willing to engage with institutions because they no longer trust those institutions exist to protect them. In fact, for a long time, we have not been trusting these institutions. And the same way in our work at a global level, through UNAIDS mostly, we are also seeing this growing political pressure to remove references to gender diversity, key populations, priority populations from international policy discussions. And Peter, you need to understand, this language to us is really not symbolic. Communities that disappear from political commitments often disappear from funding priorities, as I told you before. And this is where HIV enters the conversation. Gender matters because HIV is not just about a virus. You know, HIV is about people. It's about who can access healthcare, who can feel who feels safe enough to seek for support, and to move through society. And so, when trans people is denied healthcare or education or is pushed out of employment simply for being transgender, for our gender identity, the consequences become matters of public health issues, and they have a direct impact on our capacity to access HIV prevention, testing, treatment, so on and so forth. This, of course, affects our overall well-being, and the issue, of course, it doesn't stay there. It's much more complex than that, because the reality is that many trans people are not just navigating the difficulties of a diverse gender identity. We're also navigating loneliness and poverty and migration and racism and sexual violence and much, much more. So for some, this lack of opportunities created by these structural barriers means relying on survival economies like sex work, for example. Others use drugs recreationally, socially, or as a or as a coping mechanism, which sometimes can be a response to chronic stress and trauma and exclusion. And all of this just exacerbates our risk of acquiring HIV. Now, let me be clear, neither sex work nor drug use should be grounds for stigma or harassment or criminalizations or violence. Yet, in many contexts, they become additional reasons for police targeting, for discrimination, for exclusion of services, and even exposure to deadly violence. So to start closing here, the research consistently shows that HIV marginalization among the trans communities is shaped not simply by identity, but by the intersection of all these structural realities. And they all contribute to this higher risk of HIV acquisition that I mentioned before. And in fact, as I think that your colleague mentioned before, there's like this really beautiful systematic review and meta-analysis made by Sarah Stutterheim that reports that HIV among trans populations found that trans feminine people, especially trans feminine people, are approximately 66 times higher, have 66 times higher odds of living with HIV than adults of the general population, while trans masculine people have approximately 7 times higher odds. So yes, Peter, gender matters.
Yes, thanks so much. Thanks so much for your statement. Very, very, very strong. And when you said that language is not symbolic, I mean, I couldn't agree more. We live in Germany, a country that 8 years ago burned books and sort of made voices of people invisible. And we know what the results are. And if countries start doing something similar now and not acknowledging that there are different varieties on gender identities, then the same might happen again, and we see this in countries. So thanks so much for your statement, and I hand over now to Sasha. Sasha, please go ahead.
Violeta, now I would like to welcome you, and at the beginning I would also ask you to please tell us more about World Council of Churches, what play does it role within the global HIV response? And as a second part of the question, I would like to talk like in the context of HIV prevention, and generally churches are seen or associated with conservative positions, and especially in debates around gender norm, sexuality. What discussions are you currently having within churches, and what concrete changes and impact are you seeing in relation to the growing anti-gender backlash and HIV response? And again, you have 6 minutes. Please go ahead.
Okay, so good morning. It's very nice to be with you. I am from Bolivia. I am based in Geneva since 2022, working for the World Council of Churches in the Health and Healing Unit. I am an anthropologist. I am an activist openly living with HIV and also a rape survivor. So the World Council of Churches is a global fellowship of churches representing 580 million Christians across the world. And they work in a lot of topics. Health and healing is one of them. And the focus that we have is mobilizing communities for understanding better issues like HIV, but also bringing these communities together with religious leaders, creating safe spaces for the encounter and the action, joint action. We always involve the communities in all our activities, and I mean diverse communities participate in our activities. Some of these happen in Africa, some happen in Latin America, in Asia, as much as we can afford those. Now, about the question of some churches being associated with these conservative views on gender. Churches, when we say churches or the faith sector or faith-based organization, we are referring them as a big group of people and communities, organizations, and churches. But they are very diverse also. Some of them are very conservative and some of them are very progressive and affirming. And what we are seeing now is that in this context of polarized discussions and politicized discussions, faith is being used, religion is being used to justify some of these political gains and goals that some countries have. and some charges are being taken into that, but others are precisely because of that reaffirming their commitment. They are standing with communities and with the most vulnerable communities. One example of that is the World Council of Churches, which in the middle of this HIV funding crisis, when many are leaving the HIV response, and I'm not talking about the faith communities only, but about globally HIV is being forgotten or being decided not to be a priority anymore. We are keeping the HIV program as a priority in our health and healing work, and many churches are doing this with us. I can give you positive examples of Methodist Church in Togo, Methodist Church in Nigeria, Moravian Church and Lutheran Church in Nicaragua. And so there are many churches that are following this, and they are actually asking for us to participate in activities related to HIV. So there are diversity in this faith sector. Thanks God, not everyone will allow their faith to be politicized for political discussions and justifying violence. And so we are trying to build on these churches that understand what is the gender implications of HIV and for life. You mentioned what is that we are seeing now in the context. Because gender is an essential part of our identities, we cannot have the HIV response without gender. And the churches are understanding this. We have discussions about this. We create something like a safe space. We call it safe space dialogue, in which the churches are told to reanalyze whatever vision they had about what is gender, for example. Some of them may just heard some negative ideas of what is gender, and they don't really understand that this is part of our identity. So we make sure they understand this, and when they understand this, we see the transformation. Next day, they participate in press conferences together with the young people, bringing the responses, asking the wider community not to discriminate and to include everyone. The principles that we tell them to use, because this is based on the faith, is the dignity and the justice. These are things that God is asking in the sacred text of most faiths, not just Christian, but also other faiths. They have this approach. So the religious leaders understand this. And then when you bring this in the discussion, you can no longer justify any discrimination against any community. And you must be inclusive, because being Christian means being radically inclusive and being on the side of the vulnerable communities. In the HIV response, with this context of crisis, when the HIV response is basically breaking up, who is the most affected is the communities. And these communities that are most likely to get HIV because of this discrimination that we see related to gender. So these people, as Amanita was saying, they are not getting access to prevention, to care. They cannot even be registered in some countries. It's illegal even to exist. So this is what I will tell you now. Maybe in the second panel, I can tell you more.
Yeah, thank you so much, Violeta, on reflecting how faith and religion is being used in politics. And it's amazing to have ally and community representatives on that side. Thank you again for your reflections on that. And we have now talked about current situation and key challenges. And now in the second round, we want to focus on possible solutions, if there are any political expectations, also in connection to the upcoming HIV higher level meeting, and the ways forward for strengthening inclusive and human rights-based HIV response. Peter?
Yes, thanks so much, everyone, so far. What a rich discussion. Kate, over to you now, as you hear it, as you listen. I mean, this is now about the solutions, about strategies, about how to use the UN high-level meeting on HIV that is coming up soon, that has a certain language that where we all have to make sure that that our issues are addressed and that the right language is used. So you come from a region that probably suffers a lot from the current funding developments, and you have to respond somehow to the ideology that is imposed to you. So how do you deal with that? What are the solutions, and what are you exactly doing to sort of get out of that crisis? Thanks so much for being with us again, Kate, and to all speakers, only 5 minutes, please, because we did overstretch a little bit our time. So 5 minutes, and I'm going to stop you after 5 minutes.
Absolutely. Thank you so much. And I'm happy that you asked about the high-level meeting. In our experience, one of the first frontline platforms where we saw this bold attacks by the anti-rights was also in the multilateral space at the UN, especially with the Commission on the Status of Women, Population and Development. And I think the last time we had the UN high-level meeting, the political declaration went to a vote. So it's very important that we recognize that the attack is also it's a political project, and HIV work, gender, and SRHR happen to be casualties along the way, but very important in terms of unmasking what is happening. And I think there are two things in terms of solutions. We do have a lot of emergency work needed in terms of restoring services and frontline life-saving support that continues to be at risk. So even as we respond at the meta level, we also have to remember that in many times, in many discussions, that lives are at risk in many cases. As we spoke, we have new infections that characterize the face of the attack. Most of them are happening amongst adolescent girls, young women, as we had in terms of the opening statement. So we need solutions that also strengthen movements to respond, strengthen movement to outlive the attack. I don't think it's backlash anymore, but it's a long-term fractured and coordinated attack that really is meant to weaken civil society and erode movements that have been set up over time, and also just erase communities and their existence. So it's very important that we have resources and investments that strengthen the architecture of communities. The other bit that it's very important to think about, especially in relation to the high-level meeting, is that the language of erasure is not coincidental. And so as governments are pushing for the political declaration, it's important that we make sure that there is recognition of community leadership within the response, and the representation of communities in all their diversity at the table in terms of discussing what the next normative framework for the global HIV response looks like. And for us, reaffirming the language on human rights from the 2016-2021 declaration is very important. I think it's not just the ceiling, it's also just the basic start, because when we start from a deficit point, we end up moving backwards. And I think that's what we have seen as a tactic of the anti-rights movement, especially when it comes to negotiation. So it's important that we continue pushing for bold commitments in terms of community leadership and investment in the response. The other bit that we need to think about is critically, beyond the funding, we also need to make sure that as we push for integration, we don't invisibilize strong aspects of public health systems. I think many times when we talk about integration, it's meant to lump up services and make it and focus on efficiency as opposed to lives. So we have to continue pushing for integration that still keeps visibility of the issues and does put those who, the language of the UN, those most left behind. We have to make sure that we think and explicitly mention who are most left behind. And so that's very important. And I think the other bit in terms of solutions is to continue rethinking what narrative change looks like, because over time, one of the things that the anti-rights movement has done very well is co-opting human rights language. For example, whether it's about couching safe motherhood as a way to eradicate reproductive rights, or weaponizing the language of family values as a way of erasing diverse families, whether it's erasing trans people, whether it's erasing intersex persons and gay persons, or criminalizing certain communities. So we do have to collectively as a movement and as movement, because I know that we come from different movements, it's important for us to collectively think about narrative change and what that looks like in terms of advancing a progressive human rights framework. The other bit is also the defense of systems that we have built for a very long time. Even as we think about, for example, the UNAIDS framework that we are seeing proposed some mergers between UN organizations like UNFPA, UN Women, and sunsetting of UNAIDS. We have to think about the role of communities in terms of leadership, for example, through the PCB and safeguarding those strong governance mechanisms, but also safeguarding mandates of UN agencies that keep communities and their needs at the center. If we think about the merging of UN Women and UNFPA, what does it mean for gender-based violence prevention and response programming? What does it mean in terms of funding flows for partnerships with civil society and their organizations? So for us, that's important to continue advancement. Leadership for communities, I'll summarize. Human rights language that's very progressive. SRHR and rights language that explicitly mentions the needs of adolescent girls and their diversity. And just to say that we do have, of course, asks on this, but we'll continue also hoping that we have a global coordinated advocacy outreach as we prepare for the next few weeks.
Thank you.
Yeah, thank
you. Thank you, Kate. And sorry, I hate that, but 5 minutes are over, but I really couldn't agree more. Everybody who knows us knows that we are so eager to sort of discuss the sunsetting of UNAIDS and this UNAIDS process and everything that gets along with it. We live in dangerous times, and I agree with you that we have to sort of take care that the voices of communities are still there, even after, these developments proceed or after maybe there was a sunsetting of UNAIDS. Who knows? We don't know yet for the time being. With this word, thanks so much to you, and over to Sasha, please.
Yes, I would like to go back to you, Amanita, and in the times when everything around the word gender is increasingly being avoided or politicized, the EU recently adopted a new gender equality strategy. I had a look at it, I followed the process, and they highlight equality, inclusion, freedom from discrimination. I see some, I don't know how I feel about it. So I would like to ask you the first part of the question. Where do you see gaps between those important policy commitments and the realities faced by trans communities? And also the second part, what are your expectations ahead of UN high-level meeting on HIV and your red lines? Please go ahead.
Those are two really powerful questions to answer in 5 minutes, but I'll do my best. So let's start by saying that one of the things that struck me the most when I was analyzing the new strategy was that despite years of advocacy from trans communities, trans people are not mentioned even once in the document. The previous strategy at least referred to gender identity, gender expression, and sex characteristics. This one doesn't. So the documents speak about the diversity repeatedly. It's true. Yet some of the people currently at the center of the anti-gender backlash, we were effectively invisible within this strategy. That contradiction is impossible to ignore. So from an HIV perspective, it's even more concerning because the EU has not had an HIV action plan or strategy since 2016. So no matter how much advocacy is carried out by civil society organizations or NGOs, not even by clinicians or researchers, the European Commission continues to refuse to develop a new one or to develop a gender equality that significantly and meaningfully includes trans people. And at the same time, the European Parliament reduces funding for community-led HIV research, monitoring, and services year after year. So if you ask me, and I want to be a little bit more precise, but basically, the EU needs to understand that HIV responses do not succeed simply because medicines exist or because the technology advances. The HIV responses succeed when we place people living with and affected by HIV, such as trans people, at the center of the response. And they succeed when communities are involved in timely and meaningful design. The new gender equality strategy largely fails to address many of the barriers that trans people actually face when it comes to HIV or when it comes to existing restricted access to gender affirming care throughout the region, or barriers to HIV prevention, or hormonal shortages or illegal obstacles to access many different type of services, including healthcare. So if you ask me, the gender equality strategy is the bare minimum, and it's nowhere near enough for us. It's in fact, in my opinion, an embarrassment to the European Union. Now, in regards of your question of the HLM, my expectations are actually quite simple. I want the governments and multilateral organizations to remember why the HIV response became one of the most successful global health movements in history. It was not because of them, it was not because of the governments, it was because of communities and because the way that we demanded to be seen. Because people living with HIV and including MSM and trans communities and sex workers and migrants and women and people who use drugs, we demanded to be seen. And again, the progress happened because the communities that were being ignored and stigmatized fought for a seat at the table. So communities can, like that is to me my first line. Communities cannot simply be consultants of programs. We must remain partners in governance, in accountability, in monitoring, in decision-making, in policy development. The HIV response has always been unique because affected communities were not treated as beneficiaries, right? They were treated as experts. We were treated as experts and leaders and partners. Any attempt to weaken that principle would deeply, deeply, deeply harm the HIV response. That is actually the beauty of UNAIDS, the same UN program that Secretary General Antonio Guterres wants to sunset by the end of this year. Now, my second line is more pointing into matters of human rights and centering human rights in the heart of the HIV response. We cannot end AIDS while simultaneously weakening commitments to non-discrimination or bodily autonomy or gender equality and gender equity or to sexual and reproductive health and rights. Definitely not on basic things for the key populations like harm reduction or trans-specific healthcare or decriminalization of sex work and drug use. And like that's the thing, like the evidence is overwhelming. Punitive laws, stigma, discrimination, criminalization, and violence do not stop HIV, they fuel it. Now, to start closing, because I know that I have 30 seconds left, we cannot end AIDS while making invisible the people most impacted by the epidemic, right? So people living with HIV and key and priority populations must remain visible throughout the political declaration in a very explicit matter. And so their very specific biomedical and psychosocial needs. And I want to be very clear about why this matters, because sometimes people dismiss these discussions as debates about language, but language is just never language. When communities are not explicit in the declaration, they're not counted as indicators, which leads to them disappearing from accountability mechanisms and eventually from programs and services. That's what's happening to trans people right now. And when that happens, people are left behind. We are the least visible population in the zero draft of the political declaration, and that is a huge concern. And finally, I would like to see just like the governments to recognize that the HIV response does not exist in isolation from what is happening in the wider world. If the world is serious about ending HIV, AIDS as a public health threat, then we must be serious about protecting the conditions that make that goal possible. Human rights, community leadership, meaningful participation, evidence-based policies, and equitable access to healthcare. Because the lesson of the HIV response has always been the same. When communities lead, health outcomes improve. When communities are excluded, people die. Thank you.
Thank you, Amanita. Very powerful. And thank you again for highlighting that. And when we are talking about gender, it's not about wording we are using. It is actually long-term decisions and obligations and commitments of governments of who will be seen, who will be heard, who will have access, and who will be left behind. Thank you again for highlighting this. Over to you, Peter.
Yeah, thanks from me as well, Amanita. When I listened to you, I sort of thought about the Denver principles. These were the first principles that the HIV community developed. And it says, we are more than patients. We are people living with HIV. And you said, we are experts. We are more than beneficiaries. This is basically what, this means something, and this is very important. Over to you, Violetta. You talked about the diversity of churches. I like this very much. I have a church background as well. I was a deacon 100 years ago and worked there, Lutheran church. The diversity. It looks to me that those who have strong political voices, like the right wingers, are much stronger than those who have a more diverse sort of background. So what are the churches doing? What is your organization exactly doing in order to deal with that backlash? In terms of the UN high-level meetings, where are for you the red lines? We heard already a lot, but you might have your specific red lines here as well. And last point, the International AIDS conference is coming up. What is there in for you, and what are your strategies to use that conference? I hate it to say, but you have 5 minutes and not more, so please stick with 5 minutes. Thanks so much.
Okay, so let me start with the high-level meeting. I think if we have a very weak text and it's only a checkpoint for the member states, then it's probably a loss, because then the erasing of HIV will conclude. And for me, 2 points are key in the political declaration that will come. First, sustainable funding for the HIV response, that I think has to go through partnerships that are so wonderful, like the Global Fund, but also to domestic resource mobilization, preparing the countries to be in the long term independent of the international cooperation. But right now they cannot do it, many cannot do it. And secondly, the community response in the HIV response. The Global Fund is supporting activities of the community that are essential to the HIV response, and also other cooperation was sustaining this. It is very important that we keep this, because we have seen the numbers, how the community efforts increase access to HIV testing, to treatment and prevention. And these are not necessarily always a priority for the governments. So we must protect what we learned all these years with the community involvement in HIV prevention and care. So then going to the AIDS conference, we have the Interfaith Networking Zone, and then we have some sessions precisely discussing this, the backlash, the role of community, and encounters between religious leaders and young people. We will not be able to mobilize a big number of religious leaders because it's very, very expensive, but only maybe 2 religious leaders, 3 religious leaders in AIDS conference. At some point, we will share this program with you, and you're very welcome to come. I think we will meet you there. Now, about the churches, what we are doing for this moment that is so strong in backlash. Not only is a backlash on gender equality, but it's a backlash on democracy, on the civil rights that we have. We have so many conversations with leaders. Some of these conversations are very public, like, for example, when we do a press conference. Some are like more quiet conversations with some leaders, particularly in countries that we know are going to do something. I don't want to say we did this in this country because I don't want to expose the religious leaders, but we know the religious leaders have strong connections with the politicians, in some countries more than in others. And so we provide the right information. Why this is more than simply a language, like previous speakers were saying. Why this is important for the issues of justice and dignity, which are Christian values. So we talk to these religious leaders, sometimes alongside politicians, with help of other partners. We are doing something like this now with one partner. Or we talk directly to the politicians, like we will do this week in some country in Europe. So we are doing this. We are also building the capacity of religious leaders to understand what is an HIV response that is going to bring gender transformation. We don't want to keep the status quo of patriarchy. We know patriarchy is in many cultures yet, and this is very unequal, and this is creating vulnerability for some communities. So we make them understand this. We're also mobilizing resources, small resources for the communities, which we started doing when the cut-off fund came. And we are also amplifying these voices and providing strategic encounters between religious leaders and communities, make them allies and have a joint plan and speak about this. And the main point of this is not to lose the community responses, to keep the HIV responses a priority, particularly the funding, and to include all the voices. Do not allow the communities, particularly the most vulnerable, the LGBT communities, the young people, the women, the teenagers, to be left in this transition of funding or whatever. And the religious leaders are responsive. The very conservative religious leaders, they are not very easy to get, but we are still having conversations with them, including in whatever country that you think they are not accessible. We are having conversations with them, and I hope at some point we can have them also as speakers in such webinars like this. Thank you.
Thank you, Violetta. Yeah, let's not use faith for short-term political gains. Let's not use HIV to achieve political gains, because this is exactly what's going on at the UN high-level meeting, that you have these countries, and in order to make a stand and they use HIV to promote their policies that have probably not that much to do with HIV in the first place. If I listen to, I mean, we all listened to the conversation. We heard many different aspects, and Denver principles, gender transformative approaches. We heard about norms, about family values, about values from the community, all of that. If you consider the conversation that we just have, I invite every speaker now, and we start with you, Kate, to articulate your take-home message. So what is the most important aspect that you listened to? You only have 1 minute. If it's just one sentence, it's fine enough. And after that round, we will have a short closure by Tillman. Kate, over to you. 1 minute. We cannot hear you. Yes, now we hear you.
I have to leave actually after this, but I thank you so much for this very insightful comment. And I have three comments. One is that just to reiterate that initially we were framing this as pushback and backlash, but it is a very intentional political project that has, that also includes dismantling of infrastructure that has been built for a very long time. And it's very important for us to frame it and continue to analyze it in that context. And for us to understand this for what it is, that HIV and SRHR are just casualty topics, but the intention long-term is to undermine democracy, human rights, governance, with communities as disposable along the way. The other bit is that one of the things that I like to remind us is communities are still strong, and communities will remain strong despite the attacks. I think that's one thing that we keep forgetting. And despite the challenges we are facing, we have also seen a lot of folks who are holding the line and pushing the line. And so it's not just all doom and gloom. There's a lot of work being done. But I think when we rethink and make asks, maybe it's time for us to be very bold and rethink of what you want to reframe as our asks for the multilateral system, as our ask for our governments, as our ask for each other. So thank you so much. Back to you.
Thanks, Kate. Over, Amanita, to you.
I think that I could just simply summarize it into one sentence. People cannot be healthy, safe, or thrive when they're invisible. And the HIV response taught us that health outcomes improve when communities are seen, included, protected, empowered, and that the anti-gender backlash is fundamentally trying to strip that away and make very specific communities invisible. And that is why it threatens not just trans rights, but like public health and human rights and democracy overall. The anti-gender movement, it's literally challenging and destroying democracy worldwide. And it's shown in the HIV outcomes of the populations that are targeted by this movement. So I'm going to leave it there, Peter. And thank you again so much for this invitation.
Brilliant that you have been with us. Thanks so much, Amanita. Violetta, your last words.
Okay. Having an HIV response that is based in dignity, no one left behind, in equity, equitable services, including for innovations, and based on human rights, which is this framework of no one left behind. This is the will of God. This is what God wants. God wants a fair, good, equitable HIV response, and the religious leaders know this, and they are going to help in make this happen. This is about bringing the kingdom of God, justice to the earth. We are trying to make them aware of this. This is the moment to act. We tell them, and they are agreeing to be with us. So let's keep working until we see the transformation that we want.
Thanks, Violetta. And now over to Tillman. We are already over time, but some brief reflections by you, Tillman. Please go ahead.
Okay, thank you. And as we are now slowly coming to the end of this fascinating and very important discussion, I would like to highlight one key takeaway. Global funding cuts to HIV work combined with the anti-gender backlash, as well as the criminalization of sexual and reproductive rights and LGBTIQ+ communities, are creating a chilling effect and are threatening the work of HIV organizations and networks around the world. At the same time, much of the global resistance to human-centered, evidence-based HIV work is driven behind the scenes by far-right actors and movements in the US and Europe. Therefore, in order to protect the most vulnerable and marginalized communities from HIV, we cannot ignore these political dynamics. We need to address them, push back against them, and transform them, so that evidence-based HIV prevention, diagnosis, and treatment can work for everyone. This is not only a technical or medical issue, but fundamentally a question of human rights and the right to health. Only if these rights are upheld in practice can we ensure effective epidemiological control of HIV and make real progress towards ending the epidemic for all communities. And we hope that today's discussion will contribute, at least in a small way, to these goals. For those who would like to revisit the discussion, the session has been recorded and will soon be available on our webpage. Feel free to share it with colleagues or return to the key moments. We will also make the recording available to all registered participants. I would also like to extend my sincere thanks to our guests and moderators for this excellent discussion, as well as to everyone behind the scenes who helped prepare and organize this session. Additionally, please stay tuned for further updates on our upcoming Fireside chats, which we will share with you as soon as possible. Please keep an eye on your inbox, as save the date will be sent out shortly. But before we officially close this Fireside chat, I would kindly ask everyone to switch on their cameras, as we would like to take a group photo. I will now hand over to my dear colleague Johanna Fipp, who will guide us through this.
Yeah, hi everyone. So I'll take the screenshot. I see already many faces. That's great. So I try to smile and take the screenshot simultaneously. So let's go. Yes, I think it worked. So
Perfect.
yeah.
So we can go
Thank you
home.
so much.
Bye-bye.
Yes.
Thank you.
Thank you. Bye-bye.
Thank you
Thanks
so
a
much,
lot.
Peter.
Thanks to
Bye-bye.
And good
everyone.
luck.
Bye.
You're
Nice
wonderful.
And
to
good luck
see
with
you.
all your work
Thank you
at
so
the
much.
MSTF.
Bye-bye.
Bye-bye.
Bye.